Hello, my name is Dr. Alexey Aleshin, and today I want to discuss with you the issue of minimal residual disease across multiple solid tumors. Historically, it's been very difficult to identify patients who have residual disease after treatment by surgery or, for example, chemoradiation. Knowing if patients still have micrometastatic disease is imperative to know which patients may benefit from escalated adjuvant strategies and which patients may benefit from de-escalation strategies. Today, it was my pleasure to discuss some of the data generated with a brand new assay called Signatera that's for the first time being offered across South America with our partner, Gene1. This assay is the first purposefully built MRD cell-free DNA test that's designed to identify minimal residual disease across multiple different tumor types. For example, our data that's been published across publications like Nature, JAMA Oncology, JCO, as well as Clinical Cancer Research, has shown extremely consistent results. Namely, that if we detect Signatera positive ctDNA in patients with early stage disease, every one of those patients has an exceedingly high risk of relapse with enough clinical follow-up. Similarly, patients who do not have any circulating tumor DNA have exceedingly low risk of relapse, less than 5%. For example, in colorectal cancer, we show that patients with either stage 2 or 3 disease who were ctDNA positive had a hazard ratio of greater than 7 for relapse if they were ctDNA positive after surgery. This hazard ratio is significantly larger than standard clinical and pathological risk factors that have been traditionally used to stratify risk in these patients. For example, lymphovascular invasion, high T stage, as well as perforation. The effect of ctDNA on prognosis is so significant that when you do multivariate analysis, no other traditional clinical or pathological risk factor retains statistical significance. It's truly that ctDNA is the most independent prognostic factor known to identify patients at high risk for relapse. Furthermore, we discussed data that Signatera can be used for treatment response monitoring. We highlighted some of the data that was presented this year at both ASCO as well as ESMO, showing that circulating tumor DNA can be tracked dynamically in patients being treated with immune therapy. ctDNA changes were one of the best predictors of response as early as 6 weeks into patients' immunotherapy treatments. For example, patients who had ctDNA increases had an over 95% risk of progressing within 6 months. Alternatively, patients whose ctDNA decreased just after 6 weeks of starting therapy had an exceedingly high response rate as well as extension in their overall survival. Furthermore, for the first time, we also showed that patients who achieved ctDNA clearance or complete elimination of the ctDNA in their circulation had an exceedingly good prognosis, to the point that we have not seen any patients succumb to their disease if they cleared ctDNA with their immune therapy treatment. So, in summary, we are extremely excited to partner with Gene1 to bring Signatera to the clinical market here in Latin America. We think the test is revolutionary and is set to change how early stage cancer is managed in this country and the worldwide market. Thank you.